Question 1. Given the circumstances of Mr. Howard, a 63-year-old patient undergoing a percutaneous biopsy for suspected lung cancer, he has a known allergy to iodine-based contrast media. During the procedure, the radiologist decides to use a non-iodine-based contrast medium, but Mr. Howard begins to experience mild allergic symptoms. What should be the immediate course of action? A. Administer oral antihistamines and continue the procedure. B. Discontinue the procedure and administer intramuscular epinephrine. C. Administer intravenous fluids and wait for symptoms to resolve. D. Continue the procedure as symptoms are mild and self-limiting. Answer. Correct answer. B. Discontinue the procedure and administer intramuscular epinephrine. Explanation. According to the Society of Interventional Radiology SIR guidelines, when an allergic reaction occurs during a procedure, especially in the case of contrast agents, immediate management is crucial. Symptoms such as mild swelling, rash, or difficulty breathing indicate an allergic reaction that could escalate quickly. Intramuscular epinephrine is a first-line treatment in this case to counteract severe allergic responses. Continuing the procedure D, or simply administering oral antihistamines A, would not be sufficient to address a potentially severe reaction. Intravenous fluids C are often used for volume resuscitation, but epinephrine must be administered immediately for severe allergic reactions. The priority is halting the procedure and stabilizing the patient. Question 2. In the context of a patient undergoing transarterial chemoembolization TACE for liver cancer, the procedure involves embolizing the blood vessel supplying the tumor while administering chemotherapy. What is the primary purpose of this embolization? A. To prevent bleeding by blocking all vascular supply to the tumor. B. To reduce the size of the tumor by depriving it of oxygen and nutrients. C. To increase the blood flow to the tumor and enhance chemotherapy absorption. D. To create a permanent blockage of the artery supplying the liver. Answer. Correct answer. B. To reduce the size of the tumor by depriving it of oxygen and nutrients. Explanation. TACE is a targeted treatment method used primarily for hepatocellular carcinoma, liver cancer. The procedure aims to embolize the arteries supplying blood to the tumor, depriving it of oxygen and nutrients, which helps reduce its size. While some embolization techniques may also induce a degree of ischemic necrosis, the objective is not to stop all blood flow to the liver, but to specifically target the tumor. Increasing blood flow C would be counterproductive in this scenario. Option D is incorrect, as TACE does not result in permanent blockage, but a temporary one to control the tumor. Question 3. What is the most critical consideration when performing a central venous access device (CVAD) placement in a patient with severe thrombocytopenia? A. Use a smaller catheter to minimize bleeding risk. B. Ensure the patient is placed under general anesthesia to minimize movement. C. Ensure proper hemostasis and have blood products available in case of bleeding. D. Administer anticoagulation therapy prior to insertion to prevent thrombosis. Answer. Correct answer. C. Ensure proper hemostasis and have blood products available in case of bleeding. Explanation. In patients with severe thrombocytopenia, the risk of bleeding is significantly increased due to a low platelet count. Proper hemostasis is essential during and after the insertion of a central venous access device (CVAD). Blood products, such as platelets or fresh frozen plasma, should be available to manage potential bleeding. Using smaller catheter A may reduce the risk of bleeding slightly, but does not address the underlying issue of platelet deficiency. General anesthesia B is not required for CVAD placement and may complicate the procedure in critically ill patients. Anticoagulation therapy D is not recommended in thrombocytopenic patients as it would further increase bleeding risk. Question 4. Which of the following is the most effective method for reducing radiation exposure to personnel during fluoroscopy-guided procedures? A. Using a higher fluoroscopy setting to decrease procedure time. B. Positioning the patient close to the radiation source for better image clarity. C. Using lead shielding and limiting exposure time. D. Relying solely on collimation to limit the beam size. Answer. Correct answer. C. Using lead shielding and limiting exposure time. Explanation. According to radiation safety principles, The most effective methods for reducing radiation exposure are minimizing exposure time, increasing distance from the radiation source, and using shielding. Lead shielding C is essential to protect personnel, and reducing exposure time is key in limiting total radiation exposure. Increasing fluoroscopy settings A would increase radiation exposure contrary to safety guidelines. Positioning the patient closer B would expose both the patient and staff to more radiation, which is unsafe. Collimation D is useful for limiting the beam size, but it does not address all exposure concerns. Question 5. From the perspective of a radiologist performing a biopsy under ultrasound guidance, why is it essential to maintain sterile technique throughout the procedure? A. To prevent patient discomfort during the procedure. B. To minimize the risk of post-procedure infection and complications. C. To ensure a clearer image during the biopsy. D. To decrease the amount of contrast media needed for imaging. Answer. Correct answer. B. To minimize the risk of post-procedure infection and complications. Explanation. Maintaining sterile technique is a fundamental practice in any interventional procedure, particularly when there is penetration of the skin, such as during a biopsy. The primary purpose is to minimize the risk of infection, which could lead to serious complications like sepsis. Sterile technique also helps reduce the risk of other post-procedure complications, such as hematoma or abscess formation, while ensuring a clearer image C and reducing discomfort A are important. They are secondary to infection control. The amount of contrast media D used is unrelated to the sterilization process. Question 6. What factors contribute to the choice of embolization technique in treating a tumor in the pelvic region? A. Tumor size and vascularity, and the patient's ability to tolerate contrast agents. B. The surgeon's familiarity with the embolization materials. C. Patient age and overall health status only. D. Whether the tumor is benign or malignant. Answer. Correct answer A. Tumor size and vascularity, and the patient's ability to tolerate contrast agents. Explanation. The choice of embolization technique depends on several factors, including tumor size, vascularity, and the patient's ability to tolerate contrast agents. Tumor vascularity is critical in selecting the appropriate embolization material, as more vascular tumors require specific materials for effective embolization. Tolerance to contrast agents A is also a key factor, particularly in avoiding allergic reactions or renal complications. The surgeon's familiarity with materials B and the patient's age and health status C are less decisive than the tumor's characteristics. Tumor type D is considered, but tumor size and vascularity remain the primary determining factors. Question 7. The most significant aspect of safely administering sedation in interventional radiology procedures is A. Monitoring the patient's vital signs and adjusting sedation levels based on responses. B. Administering higher doses of sedation to prevent patient movement. C. Using only short-acting sedatives to minimize recovery time. D. Ensuring the patient's oxygen saturation is above 90% during the procedure. Answer. Correct answer A. Monitoring the patient's vital signs and adjusting sedation levels based on responses. Explanation. Proper sedation in interventional procedures requires close monitoring of vital signs, including heart rate, blood pressure, and oxygen saturation. The level of sedation should be adjusted to the patient's responses, ensuring that they remain comfortable without compromising safety. Sedating a patient with high doses B could increase risk of complications, including respiratory depression. Short-acting sedatives C may be used for faster recovery but do not guarantee safety without proper monitoring. Ensuring oxygen saturation D is necessary, but it is part of a broader sedation management strategy. Question 8. In an effort to evaluate the appropriateness of a stent placement for a patient with an obstructed renal artery, what imaging modality should be utilized to assess the lesion before proceeding with the intervention? A. MRI to assess renal function and artery morphology. B. Fluoroscopy to guide stent placement directly. C. Contrast-enhanced CT angiography to assess the size and location of the lesion. D. Ultrasound to visualize the renal arteries in real time. Answer. Correct answer. C. Contrast-enhanced CT angiography to assess the size and location of the lesion. Explanation. Contrast-enhanced CT angiography (C) is the gold standard for visualizing vascular lesions, particularly for assessing the size and location of obstructions in the renal arteries. This modality provides detailed information about the morphology of the artery and can help guide stent placement. Fluoroscopy (B) is useful during procedure itself but does not provide pre-procedural imaging to evaluate the lesion. MRI is more suited for soft tissue evaluation and less effective for detailed vascular mapping. Ultrasound (D) is good for real-time guidance but lacks the resolution necessary to assess complex renal artery obstructions. Question 9. When considering thrombolysis and thrombectomy and treating deep vein thrombus DVT, what is the primary goal of these interventions? A. To permanently eliminate all blood clots in the venous system. B. To restore normal blood flow to affected tissues and prevent long-term complications. C. To prevent the formation of new clots without addressing existing ones. D. To immediately restore venous pressure to prevent further venous congestion. Answer. Correct answer. B. To restore normal blood flow to affected tissues and prevent long-term complications. Explanation. The primary goal of thrombolysis and thrombectomy is to restore normal blood flow to the affected tissue, relieving the acute symptoms of deep vein thrombus DVT and preventing complications like post-thrombotic syndrome. These procedures do not permanently eliminate all clots, but aim to clear the obstructed vessel, prevent further complications. Preventing new clots (C) is important, but not the primary goal of thrombolysis. Restoring venous pressure (D) is secondary to ensuring proper circulation and preventing tissue damage. Question 10. In the absence of real-time imaging, how might one explain the difficulty of performing a biopsy without guidance, particularly in a deep-seated organ? A. The lack of real-time imaging makes it difficult to visualize the needle's path. B. Needle position is easier to control when there is no imaging. C. The procedure can be performed faster without the need for imaging assistance. D. Patient discomfort is minimized without the use of imaging. Answer. Correct answer. A. The lack of real-time imaging makes it difficult to visualize the needle's path. Explanation. Performing a biopsy without imaging guidance significantly increases the difficulty of accurately positioning the needle, particularly in deep-seated organs. Imaging modalities such as ultrasound (ET), MRI provide real-time visualization, allowing for precise targeting of the biopsy site. Without this guidance, there is a higher risk of damage to surrounding tissues or inadequate sample collection. While imaging may take time, C. It is crucial for accuracy. Without imaging, needle positioning is far less controlled, increasing patient discomfort. D. And procedural risks. Question 11. In the context of interventional radiology, Esther Davidson, a 45-year-old patient, has been diagnosed with a renal tumor and is being considered for radiofrequency ablation (RFA). The interventional radiologist must evaluate several factors to determine the appropriate course of action. What should be the primary consideration when deciding whether RFA is appropriate for Esther Davidson? A. The size and location of the tumor. B. The patient's age and medical history. C. The patient's pain tolerance and sedation preferences. D. The experience of the interventional radiologist. Answer. Correct answer. A. The size and location of the tumor. Explanation. Radiofrequency ablation (RFA) is primarily effective for tumors that are localized, small, and accessible without significant risk of injury to surrounding structures. The size and location of the tumor are critical in determining whether RFA can adequately target the tumor without causing collateral damage to nearby vital organs. The patient's medical history and other factors are also important, but the main determinant for RFA success is tumor characteristics. Guidelines such as those from the Society of Interventional Radiology recommend thorough assessment of tumor size and anatomical considerations before proceeding with ablation therapies. Question 12. Given the circumstances, Mrs. Bennett, a 60-year-old patient with a history of peripheral arterial disease (PAD), is undergoing a stent placement procedure in her femoral artery. What is the primary goal of using a stent in this scenario? A. To restore normal blood flow to the affected area. B. To prevent further clotting of the artery. C. To increase the oxygen levels in the blood. D. To reduce the risk of infection in the artery. Answer. Correct answer A. To restore normal blood flow to the affected area. Explanation. The primary goal of stent placement in patients with peripheral arterial disease (PAD) is to restore patency and normal blood flow to the affected area. Impaired narrowing or blockage of arteries impairs circulation, leading to symptoms like pain and impaired tissue oxygenation. A stent mechanically holds the artery open, ensuring proper blood flow. The prevention of increasing oxygen levels and reducing infection are secondary considerations. According to the American College of Cardiology, stent placement is the well-established intervention to treat PAD when conservative measures fail. Question 13. During the process of preparing a patient for a percutaneous biopsy under ultrasound guidance, the interventional radiologist must adhere to principles of sterile technique. What is the primary reason for maintaining strict sterile conditions during the procedure? A. To prevent mechanical failure of the biopsy needle. B. To minimize the risk of post-procedural infection. C. To ensure accurate imaging during the procedure. D. To reduce the risk of bleeding complications. Answer. Correct answer. B. To minimize the risk of post-procedural infection. Explanation. Maintaining strict sterile technique during any interventional radiology procedure, including percutaneous biopsy, is crucial for minimizing the risk of infection. Infection at the biopsy site can lead to severe complications such as abscess formation or sepsis. Sterility helps to prevent the introduction of pathogens, ensuring the patient's safety. Mechanical fit of the biopsy needle, accuracy of imaging, and bleeding complications are relevant concerns, but are secondary to preventing infection, as outlined in the Society of Interventional Radiology's Infection Control Guidelines. Question 14. To better understand the patient's condition, Dr. White, an interventional radiologist, performs a guided aspiration of a suspected liver abscess. What is the primary consideration when performing an aspiration under CT guidance? A. The patient's body mass index (BMI). B. The accuracy of needle placement relative to the target. C. The patient's level of pain tolerance during the procedure. D. The speed at which the procedure is completed. Answer. Correct answer. B. The accuracy of needle placement relative to the target. Explanation. In CT-guided aspiration procedures, the key factor is the precise placement of the needle to access the target area, here the liver abscess, while avoiding injury to surrounding tissues. Accurate needle guidance ensures that the aspirate is taken from the correct location, leading to an accurate diagnosis and effective drainage of the abscess. While BMI and pain tolerance are relevant, they are secondary concerns compared to the precision of needle placement, which is vital for the procedure's success. The Society of Interventional Radiology emphasizes image-guided procedures for their high accuracy. Question 15. What would happen if a patient undergoing transarterial chemoembolization TACE for liver cancer develops a fever shortly after the procedure? A. It indicates a successful treatment response. B. It is likely a sign of a post-procedural infection. C. It is an expected and transient reaction due to inflammatory response. D. It suggests that the chemotherapy agents have been ineffective. Answer. Correct answer. C. It is an expected and transient reaction due to inflammatory response. Explanation. A mild fever after transarterial chemoembolization TACE, a known expected reaction often resulting from the inflammatory response to the treatment. During TACE, the chemotherapy agents and embolic agents are delivered directly to the tumor site, leading to ischemic necrosis, which can trigger a systemic inflammatory response. Commonly transient and typically resolves within a few days. However, persistent fever or high-grade fever could indicate a more serious issue, such as infection, which should be evaluated. The American Society of Clinical Oncology provides guidelines on the management of fever in cancer patients post-procedure. Question 16. When considering an image-guided biopsy, Dr. Roberts must assess the type of imaging modality to use. What is the most critical factor influencing the choice of imaging modality for a biopsy procedure? A. The cost and availability of the imaging equipment. B. The size and location of the lesion. C. The patient's medical insurance coverage. D. The patient's history of allergic reactions. Answer. Correct answer. B. The size and location of the lesion. Explanation. The most critical factor in selecting an imaging modality for The biopsy is the size and location of the lesion. Different imaging techniques, such as ultrasound, CT, MRAP, provide varying levels of resolution and access to different body areas. For instance, CT is highly effective for deep or inaccessible lesions, while ultrasound is often preferred for superficial or ones. The Society of Interventional Radiology stresses that the choice of imaging should prioritize the anatomical and diagnostic needs of the procedure rather than financial or insurance considerations. Question 17. Given the circumstances, Mr. Haynes has been diagnosed with central venous obstruction and is scheduled for a central venous access device (CVAD) placement. Which of the following is the most important consideration when selecting the appropriate site for CVAD insertion? A. The patient's level of hydration. B. The patient's previous history of CVAD placement. C. The anatomical suitability of the venous access site. D. The patient's tolerance to anticoagulation therapy. Answer. Correct answer. C. The anatomical suitability of the venous access site. Explanation. The most important consideration in selecting the site for central venous access device (CVAD) placement is the anatomical suitability of the access site. Venous access is most commonly achieved via the internal jugular, subclavian, or femoral veins, with the final choice dependent on anatomical accessibility, patient condition, and any prior complications. Previous CVAD insertions. Ensuring optimal anatomical access minimizes procedural complications like accidental arterial puncture or poor catheter placement. The Society of Interventional Radiology outlines guidelines for safe and effective CVAD placement to reduce complications. Question 18. What factors contribute to the success of vertebroplasty for treating vertebral compression fractures? A. The patient's blood pressure and hydration status. B. The timing of the procedure relative to the fracture. C. The strength and quality of the vertebra being treated. D. The patient's preference for minimally invasive approach. Answer. Correct answer. C. The strength and quality of the vertebra being treated. Explanation. The success of vertebroplasty depends heavily on the strength and quality of the vertebra being treated. In patients with vertebral compression fractures, the procedure involves injecting bone cement into the fractured vertebra to stabilize it. If the bone is too weak or brittle, such as in cases of advanced osteoporosis, the procedure may not be effective or may worsen the fracture. Timing and patient preference play a role, but the primary determinant is the structural integrity of the vertebra itself. Guidelines from the Society of Interventional Radiology emphasize the importance of proper patient selection for vertebroplasty. Question 19. In the context of thrombolysis for pulmonary embolism, which factor must be considered to evaluate whether a patient is a candidate for this intervention? A. The size of the embolism. B. The patient's age and underlying comorbidities. C. The patient's ability to tolerate sedation. D. The presence of recent traumatic injury or surgery. Answer. Correct answer. D. The presence of recent traumatic injury or surgery. Explanation. The presence of recent traumatic injury or surgery is a critical factor in determining whether thrombolysis for pulmonary embolism is appropriate. Thrombolysis is a high-risk procedure, particularly in patients with a recent history of trauma or surgery, as it increases the risk of bleeding complications. Although the size of the embolism age comorbidities are important, these must be balanced against the risks of bleeding. The American College of Chest Physicians Act recommends carefully evaluating the risks before proceeding with thrombolysis in patients with a history of recent trauma or surgery. Question 20. During a procedure involving selective arterial embolization for a uterine fibroid, Dr. Williams is aiming to reduce blood flow to the fibroid. What is the most crucial factor in achieving successful embolization in this case? A. The use of small embolic agents. B. The precise location of the fibroid. C. The experience level of the interventional radiologist. D. The patient's tolerance to contrast media. Answer. Correct answer. B. The precise location of the fibroid. Explanation. The success of selective arterial embolization for uterine fibroids depends heavily on the precise location of the fibroid. Targeting the fibroid's blood supply through selective catheterization and embolization ensures effective treatment. While the choice of embolic agents, the radiologist's experience, and contrast media tolerance are all important, The key to success is locating the fibroid in its blood vessels. As emphasized by the Society of Interventional Radiology, accurate identification and catheterization are critical to achieving effective embolization while minimizing risks to surrounding tissue. Question 21. A 65-year-old patient with hepatocellular carcinoma is undergoing yttrium-90 Y90 radioembolization. Prior to the procedure, a lung shunt fraction (LSF) calculation is performed. What is the primary reason for calculating the LSF before proceeding with Y90 therapy? A. To determine the optimal sedation strategy. B. To assess the likelihood of hepatic artery spasm. C. To evaluate the risk of non-target radiation to the lungs. D. To determine liver enzyme function post-treatment. Answer. Correct answer. C. To evaluate the risk of non-target radiation to the lungs. Explanation. The lung shunt fraction (LSF) is calculated to assess how much of the injected microspheres might bypass the liver and reach the lungs, which could cause radiation pneumonitis. If the LSF is too high, Y90 radioembolization may need to be adjusted or contraindicated. This calculation ensures safety by preventing unintended lung radiation exposure. It is not related to sedation, arterial spasm, or direct liver enzyme monitoring. Question 22. A patient scheduled for percutaneous nephrostomy due to obstructive uropathy presents with coagulopathy equal 2.5. What is the most appropriate course of action before proceeding with the procedure? A. Proceed with the nephrostomy immediately to relieve obstruction. B. Delay the procedure and correct the coagulopathy first. C. Reduce the inert by administering diuretics. D. Perform the procedure without correction but under general anesthesia. Answer. Correct answer. B. Delay the procedure and correct the coagulopathy first. Explanation. An inert of 2.5 significantly increases the risk of bleeding during invasive procedures. According to the Society of Interventional Radiology guidelines, coagulopathy should be corrected before performing percutaneous nephrostomy. Options such as vitamin K or fresh frozen plasma may be used. Diuretics are not appropriate, and general anesthesia doesn't mitigate the risk of bleeding. Question 23. During an ultrasound-guided thoracentesis, the interventional radiologist aspirates 1.8 liters of pleural fluid. Shortly afterward, the patient becomes lightheaded and develops chest tightness. What is the most likely complication? A. Hemothorax. B. Tension pneumothorax. C. Re-expansion pulmonary edema. D. Air embolism. Answer. Correct answer. C. Re-expansion pulmonary edema. Explanation. Removing large volumes of pleural fluid, 1.5 liters, too quickly can cause re-expansion pulmonary edema, especially if the lung has been collapsed for a long time. Symptoms like chest tightness and hypotension can occur. Hemothorax and pneumothorax are also possible complications, but the timing and volume removed point more clearly to re-expansion edema. Question 24. A 42-year-old female with a history of deep vein thrombosis is undergoing IVC filter placement. What is the primary indication for IVC filter insertion in her case? A. Recurrent DVT despite adequate anticoagulation. B. Mild leg swelling following DVT. E. DVT in the absence of pulmonary embolism. D. Poor compliance with oral medications. Answer. Correct answer. A. Recurrent DVT despite adequate anticoagulation. Explanation. The main indication for IVC inferior vena cava filter placement is a contraindication to anticoagulation or recurrent venous thromboembolism despite therapeutic anticoagulation. Mild swelling or non-compliance are not accepted primary indications. Clinical guidelines from ACT and CER emphasize careful patient selection for IVC filters. Question 25. During CT-guided drainage of a pelvic abscess, what is the most important consideration to avoid complications? A. Minimizing patient movement during the scan. B. Avoiding traversal of bowel during needle placement. C. Using the shortest needle path regardless of anatomy. D. Injecting contrast into the abscess cavity before aspiration. Answer. Correct answer. B. Avoiding traversal of bowel during needle placement. Explanation. One of the most critical steps in image-guided drainage is planning a safe access route that avoids bowel and other critical structures. Traversing the bowel can lead to peritonitis or sepsis, while patient cooperation, scan quality, and contrast can help. Anatomical safety takes precedence. Question 26. A 70-year-old male with ischemic stroke is referred for mechanical thrombectomy. What is the most critical time-dependent factor influencing patient eligibility for this procedure? A. Onset of facial droop. B. Time from symptom onset to imaging. C. Duration of the thrombectomy procedure. D. Patient's blood glucose level. Answer. Correct answer. B. Time from symptom onset to imaging. Explanation. Mechanical thrombectomy is highly time-sensitive. Guidelines typically recommend initiation within 6 to 4 hours of symptom onset depending on imaging findings and the extent of salvageable brain tissue. Penumbra. Rapid imaging is key to assess eligibility. Facial droop and glucose are relevant but not decisive in isolation. Question 27. An interventional radiologist plans to embolize a bleeding gastric artery using coils. What is the most essential prerequisite before coil deployment? A. Reversal of any anticoagulation therapy. B. Confirmation of vessel occlusion via fluoroscopy. C. Selective catheterization of the target vessel. D. Sedation with benzodiazepines. Answer. Correct answer. C. Selective catheterization of the target vessel. Explanation. Embolization requires superselective catheterization of the bleeding vessel to ensure accurate coil placement and prevent non-target embolization. Reversing anticoagulation may be important but isn't always required. Fluoroscopy confirms placement, but catheterization comes first. Question 20. A patient with end-stage renal disease requires a tunnel dialysis catheter. What is a key benefit of using ultrasound guidance during this procedure? A. Shortens overall procedure time. B. Eliminates need for fluoroscopy. C. Increases patient comfort. D. Reduces the risk of vascular complications. Answer. Correct answer. D. Reduces the risk of vascular complications. Explanation. Ultrasound guidance helps accurately puncture central veins and avoid arteries, reducing complications like arterial puncture, hematoma, or pneumothorax. While it may also enhance comfort and efficiency, the primary benefit is improved safety through visual guidance. Question 29. While performing a biopsy of a lung mass under CT guidance, the patient develops the cough and decreased oxygen saturation. What is the most likely complication? A. Pulmonary embolism. B. Tension pneumothorax. C. Bronchospasm. D. Pneumothorax. Answer. Correct answer. D. Pneumothorax. Explanation. Pneumothorax is a common complication of lung biopsies due to puncture of the pleura and air leakage. Symptoms like cough, dyspnea, and low oxygen saturation are classic, while P and bronchospasm can mimic these. Pneumothorax is the most common and likely post-biopsy. Question 30. During a TIPS transjugular intrahepatic portosystemic shunt procedure, the interventional radiologist must create a connection between which two vascular structures? A. Hepatic artery and portal vein. B. Hepatic vein and portal vein. C. Inferior vena cava and hepatic artery. D. Portal vein and inferior vena cava. Answer. Correct answer. B. Hepatic vein and portal vein. Explanation. TIPS involves creating a channel between the hepatic vein and portal vein to decompress portal hypertension and reduce complications like varicose bleeding. The connection allows portal blood to bypass the liver and flow directly into systemic circulation. This is a well-established approach supported by hepatology and radiology guidelines.